All right, it is time to get started. Welcome everybody to Happy Hour at the Dry Eye Foundation. This is the first time we have ever done anything live of any kind, so it is slightly terrifying, but much more exciting. And we've got just great people here today, and I'm really excited. All right, it is time to get started. Well, okay, before we get launched, Aiden is going to go over a few technical pointers for our Zoom attendees.
Hi everyone, I'm going to share my screen again and show you. You should just have 3 buttons at the bottom of your screen, and I'll go over those. So to anyone who's viewing this on Zoom, I'll be talking to you. So you've got the chat button, the raise hand button, and the question and answer button. You can chat with the panelists or with all panelists and participants. You can also raise your hand when prompted by any of the panelists or speakers. If you're chatting with anyone, I'm probably going to be the only one who can answer you, but I'll do my best to do that. And then for questions and answers, feel free to ask questions during the live stream, and we'll get to those at the end of the session. You can also comment, I think, on the questions and upvote them if you have opinions. And then for anyone joining us on YouTube, feel free to use the live chat feature, and I'll also be monitoring that. And just lastly, wanted to let everyone know that the webinar is being recorded. We're going to put it on YouTube a little bit later, and just make sure, you know, keep your messages appropriate and everything, and enjoy the webinar, and feel free to come and go as you wish, or leave. I think that'll be it for me.
Great, thanks, Aiden. So before we get started and introduce everybody, I just want to say really briefly what this is about, what kind of the vision for this is. I've just been wanting to explore new ways for our community to kind of come together and pool our collective knowledge and experience, and start finding new solutions for things. We don't get to be our own doctors, but there is so much that we all know just from our experiences of navigating dry eye disease. And we all come through this with our own backgrounds and perspectives and just unique experiences of things. And there's just so much power to be had in pooling that. And to a certain extent, we get to do that on Facebook groups and forums. But I've been hungry for something that is more face-to-face to get people connected in some new ways, especially as we're everywhere kind of going through new forms of isolation in our lives. More connection is good and conversation is good. So we have a terrific panel here, and I'm just so thankful to each of them for being willing to leap into the unknown with me on this. I'm going to ask everybody to introduce yourselves. I'm going to start with Mandy. Mandy actually serves on the foundation board. We got to meet up. It was lots of fun back in late last year at a conference in San Francisco, where Mandy schmoozed her way through these enormous exhibit halls. It was great fun. So Mandy, we have our little list of questions you get to answer to explain who you are, but you can share anything else you want to. But we want to know what state you live in, what you're drinking, how long you've had dry eye, and why, if you know, where you're at in your dry eye journey right now, and what are the last eye drops you used?
Okay, hi everyone. I'm looking at the chat comments because someone said they couldn't hear, so I just want to make sure that everyone can hear. And also, I look like a giant mess because I fail to shower a lot during the pandemic, which is horrible. So I live in Madison, Wisconsin. Oh, that's my husband. He's bringing my wine bottle so I can show everyone what I'm drinking. So Madison, Wisconsin. I planned on drinking a beer from my local brewery, but they were out of it when I went to the store. This is a Nebbiolo di Faro, and it's from a wine vineyard, I guess, in Madison, Wisconsin. And we got it from our neighbor. It's actually really good, which is weird for Wisconsin wines. They're usually horrible. So that's what I'm drinking. And I just got these giant new wine glasses, so I love it. So I've had dry eye since I was 19. I am 42, almost 43. And I have no idea why I'm the lucky one that in my family that got it. I was very, very confused and depressed when it all started. I still go through my ups and downs. I'm aqueous deficient dry eye is how it started, but because over the years being aqueous deficient causes a lot of inflammation. I've had more problems with MGD as well. What's the next? Where I am in my journey. I have tried everything I think that's out there. Every single eye drop. Initially, I was told to do warm compresses using a washcloth and hot water. And I'm an environmental attorney by training, and so it's really hard for me to run hot water all the time. So I got like a quick warming thing that you would take for camping, and I warm my water that way and use that for my warm compress. I was initially told to use baby shampoo, which totally irritated my eyes more. And so now I use nothing, or I use, some eye washes, lid hygiene things that are made for specifically sensitive eyes. So I've done gland expression over the year, many over-the-counter eye drops, Restasis, Xiidra, Sequa, True Tear, moisture chamber glasses. I have these clear ones, which look so awesome for during the day. When I'm sitting at my computer, it really helps to keep the moisture in my eyes, especially when I'm in the office and the horrible ventilation system is blowing all over you. And I've tried scleral lenses, didn't work for me. Mostly because I think I've also found out that I have some trigeminal nerve issues on the left side of my face, which really causes my left eye, which I notice like I wink with my left eye all the time on here. And just did it. It's very involuntary. I'm sorry. So that causes me to notice the pain more in my left eye versus my right eye. And it's quite irritating and itches a lot. And it's most days there. So I'm just trying to manage the dry eyes. And over the last 23 years, I have tried different ways to just come to terms and ignore the eye issues and pain because it's going to be there the rest of my life. And instead of being constantly depressed, I'm only sometimes depressed. And I just try to find ways to forget about it and pain management, chronic pain management. So that's where I am in my journey. And the last drops I used were Refresh Plus.
Well, thanks, Mandy. Laura, over to you.
Hey, I'm in Washington State. The beverage I'm drinking is not nearly as great as Mandy's. I'm having iced coffee. I've learned how to make my own iced coffee during the pandemic, and it's not that hard. So that's what I'm enjoying. As far as my issues, they started for me about probably, 15 years ago. I had bilateral pterygium in both eyes, and I had surgeries to remove both of those. And I thought I was done. And then I developed Salzman's nodules, which became visually significant. So those had to be removed. And then, I was living in Chicago at the time. We lived in Chicago for 10 years and then moved to the Seattle area. So then around the time I moved to the Seattle area, the wheels really started to fall off the bus, and I needed to find a really good ophthalmologist, which fortunately I did. And altogether, I think I've had like 9 surgeries. I don't even know how many surgeries I've had. They've all been superficial keratectomies or filament. Well, that's only the super case. I've had also multiple filament removals too. I don't know if anyone's had corneal filaments. They're not a lot of fun. And I've had them removed manually as well as with the acetylcysteine compounded medication. So, and that caused some residual scarring. And no matter how fantastic your surgeon is, there's going to be some residual complications from these things. And so I'm very fortunate that I have a really talented team, but I'm still kind of in a rough spot right now, vision wise. So next week, actually, I'm picking up my first pair of scleral lenses. And I was sad, Mandy, when you said they didn't work for you. I remain hopeful. Part of me is almost afraid to pick them up because the anticipation of having something that's going to help is kind of buoying me. But I'm excited. I hope, listen, if they do anything, I'll be happy. But I actually see okay in glasses, but my glasses are, they're trifocals with prisms in them, and it's kind of unstable. So I can kind of fake my way through a lot of stuff, but I'm hoping the sclerals make things easier. So in terms of that, kind of my journey, basically my surgeon said was I'm at a point where the sclerals are hopefully the thing that's going to kind of keep these surgeries at bay for a little bit. And then all of this, of course, is concurrent with the dry eye piece, which is the, not helping from an inflammatory standpoint and all of the things that, everybody's talking about. So in terms of drops, I think that's where I'm at here. Yeah, in terms of the drops, my last one was my serum tears, which have been really great for me. I know the boards are lit up constantly with conversation about these things, good and bad. For me, they've been really helpful. They've helped a ton with the light sensitivity. Like, I used to not be able to do anything without sunglasses. Now I'm I'm not going to say normal, but I'm close. I can kind of pass for a person without having these issues sometimes. So the serum tears have been great for me. I also use Restasis. And then of course the frequent preservative-free lubricating drops. I did try Zydra, and that just burned so bad I couldn't deal with it. So I'm happy for those it's helping. I couldn't deal. So that's kind of where I'm at. And like Mandy, like it's kind of an up and a down thing, and you just kind of learn to live alongside of it. And it's great to have a support and people to talk to and who understand this and speak the language, as they say. So thanks for having me be a part of this today.
Hey, thanks, Laura. Funny thing is, Laura is the one on the panel that's actually relatively local to me. Give or take a couple bodies of water. But we're the ones that we haven't actually met in person before. It's nice to have somebody actually this close. Okay, over to you, Debbie. So Aiden and I got to meet Debbie in Boston last year, which was great fun. We had known each other online for quite a while before that, though.
I'm so glad to be here to share my story and to see if what we have to say can help some of you out there. I live about half an hour from Boston in Beverly, Mass. And it was 70 here today, but we're going to go into a heat wave shortly, and it's going to be 4 days of over 100. And as soon as the weather gets like that and we have the air conditionings on, I go crazy. So I even sleep in a recliner downstairs so my husband can have a fan on. So I'm not looking forward to that. And I'm just drinking water because whenever I'm on the computer, I'm supposed to drink, and blink, blink. And so that's why I have my water with me. And that's about all I drink, is water. But I did find one kind of coffee that is single sourced, organic, water processed. And I've been able to drink 1 cup a day. So I'm really excited about that. And it's not a big thing for most people, but when you have dry eye and you're deprived of a lot of things, anything that you can do to make your life a little happier, like the coffee that I have, is good. So my dry eye journey, I looked it up today, and I can't believe it's been 10 years. So 2010 was when this all started. And I said to my husband, I can't believe that this is my life. But it is, and it's a good life, but the dry eye piece is hard. I was at a normal eye doctor appointment, just an eye check. And the doctor, I said, sometimes when the heaters come on, my eyes dry out. And the doctor said, why don't we put in a punctal plug? You won't have to use eye drops. And so I said, okay, we'll try that. It fell out, and I came back to the eye doctor, and they put in a smart plug, which sits a little bit below the water line. And it caught an infection. And I went back for 6 months saying, you got to take the plug out. And they said, no, you need the plug. And by the time they took it out, it was the worst infection that imaginable, and I had to go and have surgery to remove the plug. They washed the plug out, which is not a good thing. And they said, the doctor said, go live your life. And it was all clear. I was fine. A week later, I started to tear up, and there was scarring. And he said, yes, this was the worst infection I've ever had taken care of. And so that started my journey. I had to go and have a stent put in. I had 11 surgeries, Laura, with my eye. And so there's a lot of scarring in there. And I lost all my meibomian glands except for 5 in combination, both eyes. So what happened next was I did probing, and that didn't help. And then I started to have a treatment plan with expressions, and I have most of my glands open today. And I think that's a wonderful thing for you to know, that, sometimes that can, you can get better than when you start. And I was doing great in my journey until the pandemic struck, because now I'm at home working from home on the computer 6 to 8 hours a day. And so I just was in last week, and my oils were thick and fluorescent yellow. Can you believe that? They were just disgusting. And they've been clear and good, and not perfect, but so much better. And about a month ago, I was in and had an IPL, and the doctor said, "Oh, you're a lot worse than you've been the last 3 treatments." So that would be the last 9 months. So I'm kind of at a bad place with tearing, and I'm doing a lot of interventions that, we can talk about later. But it's interesting to live with dry eye, and there's a lot of things that I do to live alongside it. I loved whoever said that. That was just a really good phrase, because it's part of my life. I know that I'm going to need to do maintenance for the rest of my life. And so there's a lot of things that I do so that it's not central. It sometimes bothers me, like tearing is not a good thing, but most of the time I can do a lot of the things that I want to do. And so that's good. And the last dry eye drops are the drops that I put in, serum tears. I use them 8 times a day. And when I'm on the computer, I'm supposed to constantly use them. So I just put them in 5 minutes before our meeting.
Great, thanks, Debbie. Well, I feel your smart plug pain. I had my own smart plug adventure, but I never went through a tiny fraction of what you've been through with that. Wow, we all come from such just different backgrounds, different histories and everything. It's so interesting. Aiden does not have dry eye, but I'm going to ask him to say a few words to introduce himself.
Hi, everyone. I'm Aiden. I'm also here in Paulsbo with Rebecca. She's just on the other side of the wall. I'm part of the Dry Eye Foundation. I'm on the board. And what else? I guess I'm kind of the technical host of the Zoom right now. So glad to be chatting with everyone. I haven't used eye drops in a while, but when I do, it's for Fresh Relieva. I like the multi-dose bottle. Anything else really? Oh, I'm drinking water. I'm not that fun. I don't think we did prepare. Yeah.
Thanks.
Apparently the only alcohol drinker, huh? Happy hour. And Debbie, I know what you mean, but sometimes a glass of wine makes things so much better for me.
Absolutely. Cheers.
All right, just very briefly from my end. I live in Washington State, like I said, and I'm drinking kombucha. Actually, I rarely do, but I like kombucha. I've had dry eye and eye pain since 2001 when I had LASIK. So that's where mine all started. Gave me some vision issues as well. Where am I at in my journey? I've just kind of been coasting for a long time. I have my ups and downs and bad days and things, but it's kind of just mostly background noise until it isn't. And then you find new solutions and you deal and you move on, and then it gets shoved to the background again. And then something rears up again, and then it gets shoved back again. I've just found that to be kind of a pattern for me. My newest thing in the journey is, actually I'm meeting with a cornea specialist next week about my first cataract surgery, which at 52, I probably wouldn't be doing that if it hadn't been for LASIK, but I am living in hope of some better night vision. So I'm gonna try it on my left eye and see what happens. Drops, I actually hardly ever use drops because I wear scleral lenses virtually all my waking hours, and I really can't stand drops on top of the lenses. I'll douse the lenses with saline sometimes, but almost anything else is just too goopy for them. So if it's a bad day and I need something, I'll maybe use some drops just before bed, but generally it's all about the sclerals. Okay, so today's topic, all about living with dry eye in the pandemic. So we're going to talk about what the past 4 to 5 months have been like, how our eyes have been affected, and what solutions we're finding for things. So Debbie, I am going to lob the first question to you. How has working from home affected your eyes, for better, for worse, and what have you been doing to cope? You touched on that as you were introducing yourself, but I can ask you to go a little further with that.
You know, there are some great things about being at home. And one is that you get to control your environment. And so I'm always, when I'm in the workplace, I'm looking for where the air is blowing and how hot it is. And so having my own humidifier at home, I have a mini humidifier right here with me at my feet while I'm working. Um, so that is a good thing about being at home. And I think the stress is also less at home. Uh, our daughter is grown, and so it's my husband and I, and there's nice family time. So, you know, those are great pieces of being at home. But I'm a college professor, and so I'm teaching 5 graduate classes from home. The weekend before the pandemic, I was in the classroom teaching a weekend class, and then 3 days later, boom, I had to convert everything to online. And so I'm sure a lot of people had to learn to use Zoom, and I had to learn to use different platforms. And so I've been on the computer about 6 to 8 hours a day. And so I'm not controlling my environment quite as well as I could be, because before the pandemic, I was on maybe 1 or 2 hours a day, and I would break that up. And so the, your second part of your question was what, Rebecca?
Just the things you're doing to cope and compensate for.
Yeah, there are so many. So the mini humidifier is good. I have my goggles that I can put on. So they look a lot like Mandy's. And so they have a rubber seal, and I can put those on if I want to. I'm blinking, I'm drinking a lot of water. So I asked my eye doctors, what are the things that I can do? So those are some of them. At night, I sleep with ointment in my eyes. I don't use a sleep mask, but I should. It's up to me whether I'd want to. I do 3 expressions a day after I do my my warm compresses. I do my warm compresses in the morning and in the evening. And my doctor said throw in another one. So I just take my finger and go along my eyelids to express, and 4 or 5 times. So that's what my doctor's technique was. And so those things help a lot. I take a lot of breaks. So I'll work on the computer for maybe 15, 20 minutes, do a task, and then I'll go and fold clothes, or, you know, do a house project. And what's been wonderful about being at home is that there are things that I've put off forever, like cleaning out my attic and my basement. And I think I've taken over 1,000 books to the book drop in our town, seriously, because I was a teacher for 38 years, and all those books were in my basement sentimentally. And so it feels good to do those things, and it helps me not to focus on my eyes. The other bad thing that's been is time on the computer that I used to have just for me to keep up with people. And so I'd chat over Facebook with some of my friends. I've had to choose not to do that now, because I need to be on the computer for business and answering emails of my students. So I kind of feel I have a good support system, but I'm not using it quite as much, because it's just painful to be on the computer. I was learning a language, and I stopped Duolingo because you know, that takes eye concentration. The best thing that I've been doing is exercising. I get up early in the morning before the sun is out. I get up at like 4:30 because I'm crazy. I'm out the door at 5, and I do about 3 miles then, because exercise is kind of my my go-to for everything. My eyes feel better when I'm exercising. Then in the evening, I walk another 4 miles. And so that's been great. And I've been able to focus on my diet, because no sugar, just really a tight diet. And I've lost about 15 pounds. It started before the pandemic, but those things all feel good, and it takes the focus away from my eyes. Let's see if there's anything else I wanted to say, because I wrote down a bunch of things.
I love
Oh,
all the ideas about just being able to control your environment and taking breaks and all of that.
yeah. I wanted to show you, I don't know if you can see this, I'll turn it sideways. Maybe you can see the flash of it, but I have a cover over my computer to take off some of the glare and the UV lights. And then I have flux on my computer, so that helps a little bit. And I'm just doing everything that I can, except I really have to reduce screen time. And I haven't done that. I think that's the worst offender of all for dry eye for me, because I have aqueous tear deficiency too. So I'm dried out, and my skin, I have rosacea, so that dries out, and then I get pimples. And so it's like, do I want to do my work or be able to see and look good? And it's a tough decision sometimes. But I hope some of those hints helped.
That's great. Thank you. Yeah, screen time is the big universal for us with work, isn't it? It's increased screen time, and how are we all coping with that? Laura, can you share about working from home
Yeah.
with you?
And actually, I think when we were doing the introduction, I forgot to mention the limbal stem cell deficiency piece too. That's sort of like the whole reason for all the problems in the first place. So here's the thing though, I just want to say quickly is that I know it's probably overwhelming to listen to us say all of these things that we're dealing with and this litany of issues and everything. I think the takeaway though too is that we're all leading pretty functional, productive lives. And there's things that we're doing here that are leading to that. So I don't want that to be a scary thing. I want it to sort of be an encouraging thing, that kind of there are a lot of management strategies around stuff. And even though it might be super time consuming, expensive, and frustrating, you will find your kind of magic solution. It's just not an easy thing to do. And I don't think anybody would say it is. So as far as the work from home thing, I think I might be kind of an anomaly. So I'm a school psychologist. That's my job. And I am in buildings with kind of, iffy heating, cooling, as well as fluorescent lights, and things like that in my real life. And when I came home, I could control all the lighting. I could control the temperature. I'm actually on my phone more working at home. And for some reason, I find the phone is less difficult for me sometimes than looking at straight at a screen. And I wonder if it's not because when you're looking down, your eyes are a bit more protected and get less dry. I mean, I have no idea, but it's something I've noticed. I cannot drive at night. And that's something I'm kind of secretly, openly hoping the glare help. Maybe they will, maybe they won't. But in the morning, kind of dealing with those headlights were really difficult for me. And that went away because I no longer have to work. So actually the being at home thing, even though I'm working just as much or was, before summer break, it actually was a much kinder setup for my eyes. So I have not been negatively impacted by the working from home. And I do think I might be a bit on my own with that, because I think most people have had a difficulty, but I haven't as much. I do pretty much the same things as everybody else. I do the warm compresses, usually in the evening if they really start to just be irritating me. I ordered Amazon. It's like a buckwheat thing you put in the microwave. It's purple, kind of a velour thing. And I don't think it's medically endorsed by any, but it's quite helpful and it kind of gives off steam and it feels good. So, hey, but I found you cannot use like a wash. You have to find something that's going to stay warm, because otherwise you're just going to keep fighting with it and you can't use it for very long. And then I just use drops, and sometimes I just have to close my eyes and just be done. And I find that that's late at night when I really want to read for fun, usually kind of like after 10 o'clock at night. Sometimes I have to kind of say, I'm done. And, that's kind of also knowing when to stop, I think, is critical. or at least it has been for me. I find sometimes when I push through when I'm not doing as well, I only make it worse. So yeah, so overall the working at home hasn't been too bad. You know, I've liked it from this standpoint. Obviously, I, like everyone associated with a school, either a parent, a teacher, staff, whoever, we want to go back. And I'll be happy when we can, but this from my standpoint hasn't been bad.
That's awesome. I've always just been so curious about that this spring, who is being helped and who's being hurt by being at home, because there's just, it really does vary, I think. On your point about the lids, like you're having your gaze downwards and having that cover the eyes more, I think this is a hugely overlooked thing in screen use in general. I mean, anyone, if you're looking straight out at a screen, a certain amount of your eye is exposed. You're going to have evaporative tear loss. The lower your lids are, the less evaporative tear loss you're going to have, because you just got that more covering on it. So got a smaller opening. So to the extent we can have our screens, just regular computer screens, a little lower, even be gazing a little lower, it can really make a significant difference with comfort levels. And I really appreciated your point about the need to take heart rather than being discouraged by other people's stories when they're complex and messy and they've been through a lot and God knows how many surgeries and all these things. Because the truth is, I think of it as a shift in thinking about what it means to get better when you have dry eye. To me, it's not about I was cured and I went on my merry way. It's a shift into my life is good. I have strategies when I have flare-ups. I'm managing, but I'm functional for the things I need to do, and I get to do things that I want to do. It's just kind of a different kind of goalpost setting. So anyway, that's something I feel strongly about, is when you hear about people having tried lots and lots of things, it shouldn't be a discouraging thing. It means that there is more and more to try, and that we find our combinations of things that work. I'm just looking at the time and I'm feeling I probably need to move on to the next question. Let's just talk briefly about masks. Mandy, do you want to tackle that one?
I hate masks.
Masks a lot. And what are masks doing for your eyes?
I absolutely hate masks, and I try to avoid going anywhere where I need to wear one. And I actually have to go to my niece's baby shower tomorrow, and I am super concerned about that. There's only going to be a few people there, but there's people coming from 4 different households. And I just had a lost 3-year-old toddler in my neighborhood the other day who just latched onto me and wanted me to hold him. And I don't know what was going on in his household. I mean, the whole pandemic makes you nervous in different ways. And if you haven't noticed, I'm very fidgety and can't sit still. And so keeping busy has been a huge thing. But I just try to go places where I don't have to wear it. And when I do have to, I hate it because my glasses fog up. Since my left eye is much more sensitive, I mean, I'm lucky that I haven't gone through all your surgeries. I feel for you guys. I worry about having surgery in the future and if that will make my dry eye worse. But when I breathe and air goes up into my left eye, it just itches and it inflames it more. And I just really, really hate wearing a mask. I did just watch some YouTube videos today on how to avoid the air going up into your eye. At first I thought, oh, if I just have like a nose wire, it'll be fine. But I did watch some YouTube videos on how you can fold a Kleenex and put it at the top of your mask, and that apparently will stop the air from going up and will catch that moisture. And if you fold it a certain way, you'll also still be able to breathe better.
Does it work? Have you tried it?
I haven't tried it yet. I'm going to try it tomorrow because I have to wear my mask all day tomorrow.
Yeah, I wondered about, because of you're in moisture chambers so much, and I've been wondering about that for people that wear moisture chambers a lot. How are they managing with the mask? Are you getting solutions to seal so that you don't?
Well, I mean, if I put the seal adapter in, which I usually do when I'm working all day, but I mean, it makes the glasses look way worse with that in. So I took them out for this. So I bet that would actually help wearing those with it, but I just spend most of my time outside and try to stay 6 feet away from people. I mean, I live in downtown Madison and everyone is outside on the bike path, and I feel like some people are careful, some people aren't. So I don't wear the mask when I'm outside, but I take wide loops around people. So, I mean, my experience with the mask has been few and far between. I send my stepkids to the grocery store. They're 20 and 22 and they're living for free right now. So we're like, you do all the work, go to the grocery store, you wear the mask, you do
So
that.
for you, it's all about avoidance, which is great.
It's about avoidance completely. So
I struggle with it a little bit because I mean, at work all day, I'm basically either I'm like this until Aiden pops his head around my door, and then I'm like this, or when I'm wandering around the office, because we're all masking at the office. But then, I need readers, and then it's the battle of the fog, and I've just been too lazy to mess with the Kleenex or whatever. I just don't think I could stand that much stuff on my face. But
yeah.
I do have to go there too. Laura, Debbie, any comments about masks?
Not really. I found a mask that has a good strong nose clip on it. I don't know if I can share brands here or not, but
Go for it.
it does. Outdoor Research makes a really good mask that has a strong nose clip on it. And that has helped a ton with the fogging. And they're also quite breathable if you have to wear them for a long time. So that has helped a lot, because the cheaper masks that don't have that really strong grip, it just, you're done in a second.
Right.
I found a good mask too. I hate masks. I'm just as bad as Mandy. I won't go anywhere. I just outside around my house. But what's wonderful about this mask is that these, they slide and there's no elastic in them. And then there's a little mesh here that will catch your breath. And I put cotton balls up at the top. My skin is really, really delicate. And so it just rubs off with a mask. But this one I can tolerate for short periods of time when I have to go places. So it's one of the Solumbra masks, which is sun protection. And it's expensive. I think they're $39. I have 2 of them, and my husband's going to have to teach. He teaches college too, and they're going to be in the fall, and they've got to be masked all day teaching. And he's going to be able to tolerate this one and not the other ones we have. We have quite a selection at home, but this is really a good one. It comes in all different colors. This is the most boring one, but I don't care. And you can wash it by hand, and it dries in about 5 minutes. Well, not 5 minutes, but like 15 minutes. It's dried, and so that I think is really nice. So anyway, I just don't ever want to wear this, but I also want to go places and do things, and so it makes it possible.
What is the brand again, Debbie?
It's Solumbra.
How do you spell it?
Solumbra.
Okay. Thank you.
You're welcome.
Right, thanks everybody. So now we're going to move on to how the pandemic has affected your access to things you need, to doctors, to treatments, to products. Let's see, Laura, you want to take a stab at this one? Have you been affected in terms of your access to doctors or care that you've needed or other things?
Well, when it started, I was kind of in the middle of this really weird, I mean, I think it was some kind of blowback infection from one of my surgeries from the medications. And so my doctor and I were in really close contact over this kind of when this started. So she was not willing to stop my visits because of the pandemic. And I had access to my ophthalmologist all the way through, and I continue to, which I'm really grateful for. The visits are definitely different, but I absolutely have access. As far as the major inconvenience I had was the delay of getting the scleral lenses. As soon as that infection, I call it infection, and I think it was an allergy or whatever it was, cleared. And I got the green light to get my lenses. All the optometrists were closed. And this, I was really disappointed because I'd been waiting a long time. But finally I did get in. And but that process was delayed by several months. So that was the biggest inconvenience. In terms of products and everything else, I've not had a problem. And now that the optometrists are open, I have two optometrists, one who's doing my sclerals, and then the other one who does my regular glasses. And they both agree that it makes sense to do it this way. So that's how I'm doing it. So I have access to, everything I've needed other than the delay of the scleral lenses, which was probably more annoying than anything.
I'm gonna say that must have been frustrating. I watched some of that play out with other people in the Facebook group of they're all excited and they're really invested in this process, and then whoops, can't come back and not sure when you can. Just some of the uncertainty of knowing when you can keep going with it. It would have been frustrating too. Let's see, Debbie, any change to what you've been able to, how you've been able to get your needs met medically?
Yes, so I do IPLs every 3 months, and I had an appointment set up, but they weren't doing IPLs, and I was the first patient back in because that appointment was when we started the reopening. But interestingly enough, when they do an IPL, it's intense pulse light, and they do it around the eyes pretty intensely, but they do the whole face. But they wanted to do it with my mask on, and that's, and it makes my face very, very sensitive. So that was interesting to have the IPL with the mask on. The second thing was I went in to have a heated expression at a different doctor, and the instrument that she uses couldn't be disinfected the way that the protocols call for. So they had to put a little rubber tube over it, and that meant that it didn't heat up to the temperature that it was supposed to. So I got the treatment. They said, you'll get some benefit, but of course it wasn't much benefit. So that was a little upsetting. And then with the serum tears, I go into Mass Eye and Ear and have serum tears made. And I went in to have my serum tears. I was just holding on to the serum tears that I had, using them less frequently because I was afraid to go in because I didn't want to be exposed to COVID right at the beginning. But going into the hospital, the protocols were in place. I felt totally comfortable. They drew my blood. I'm going again next week to get another batch. And so that hasn't stopped for patients, and I'm thrilled. What's concerning for me, though, is all the patients who couldn't get their IPLs. Now there's a backlog, and there's only so many people who can be seen a day. And so my doctor said, oh, you need another one because your eyes are so bad. And they didn't have an appointment for me, so I have to wait till September. So I think that there's going to be a backlog of patients who aren't going to be able to get their treatments when they need to because of the spots that are open. So that's concerning.
Yeah, there are capacity issues out there for sure. And then people for whom, it's just not going to feel comfortable or safe to go in. I've also just been concerned off and on about reports we get over the phone from people where drugstore shelves, where some of those drops and ointments have been empty in a number of places. And it's been kind of spotty. Of course, it was all of the panic buying in March and April that cleaned out a lot of things. But even since then, there's been some shortages of some things that have kind of concerned me because I think there's just been some production reduction at a few companies out there. So just trying to keep an ear to the ground for what's going on. Mandy, anything to add before we go on to the next one?
I've only had one telemedicine appointment with my eye doctor. It was scheduled for May. I think we're rescheduled, or we have another one scheduled in September. I see her generally every 3 months. Part of me is annoyed by the telemedicine with the eye doctor, especially because you can't tell what's going on with the eyes via telemedicine. I mean, I do telemedicine mental health appointments because I'm super depressed and anxious, and I mean, I go through those waves. And so I like to keep my mental health appointments, and that's fine, telemedicine. But eye doctor, I just don't see how it helps. And I haven't scheduled any of those treatments. I've never done IPL, Debbie. I'm interested in that. That's one of the things I haven't tried. I did LipiFlow. I've done Ilux, some other treatments, but I'm interested in trying to schedule something. But as everyone said, it's going to be much harder to get in. It's already hard to get into specialists, and it's going to be hard, and it's kind of swaying me from not trying certain things. Like I said, I don't like to go anywhere where I have to wear a mask. And I just think it's going to be really hard for all of us, especially those who are newer in the journey and trying to get in to see people, because those of us who have been dealing with us for a long time have established relationships generally with our doctors. And I mean, there's always questions we can ask via, I don't know how many people use my chart or something similar. So you can do things that way, but for someone who's just starting in their journey, I think it's going to be really hard. And I do think the support groups that we have here through our the Facebook page will be really helpful for people starting in their journey. And Rebecca, I think we've talked about doing like a mentor-mentee type thing. And for people who are far along in their journey, I think that that during this pandemic, it's going to be even a better resource, more important to have people who have gone through the journey that can talk to people and help with that depression and anxiety. And it would be good to have more access to someone than your doctor. I mean, I am teaching my doctor things about what's out there. I mean, they have so many things to stay on top of. They're not just focusing, most of them just don't see just dry eye patients. So anyway, yeah.
I love that. The mentoring. I mean, a lot of that goes on just casually on amongst people that meet up in the Facebook groups and get to know each other. But I'd love to explore ideas about how to kind of make that more accessible to more people, because I love your point about people who are new to this, facing some unusual struggles now with just getting access to what they need in a medical world that's just seeing more and more constraints right now, and having others to kind of guide them through and point out where the best doctors are, and how to navigate those appointments and things too. I'm really interested in exploring just solutions for, if we've got limited availability of specialists and things, how we can make good use of the resources that we do have. I mean, I suspect that there's going to be more optometry availability than ophthalmology, because I think an awful lot of ophthalmology, the cornea specialists are just going to be so backed up with surgeries. It would be difficult to get time as dry eye patients for visits. I think that, there may be local optometry resources we can be tapping. The telemedicine side of it really intrigues me too. I know it sounds very limited. You can't do a slit lamp exam or anything over Zoom or whatever, but yet I wonder if there might be room for something positive to come out of that, in the sense that, what's the thing that we have the hardest time communicating in these doctor appointments? It's how our eyes are feeling and how that's affecting us. And when you get plunked down in the chair and slit lamp in front of you, everything kind of revolves around what are those slit lamp findings. And it's harder to steer the conversation to what's my experience, what's my actual problem. I wondered whether telemedicine might actually be an opportunity to really work those conversations with our doctors, give them our, symptom scores, and start talking through, what are some solutions to my practical problems, not just my tear breakup time. Anyway, that's my thought. We're getting close to out of time here. I think the other questions I have, we've kind of covered a lot of that in the course of the discussion. I think I want to touch just briefly here. We've hit on this a lot in the course of the other questions, but the mental health thing. Mental health is, forget the pandemic. Mental health and dry eye just go hand in hand. Depression and anxiety are really closely associated with dry eye. In our Foundation survey, we're seeing up to 20% of people who've taken the survey reporting having experienced suicidal ideation because of dry eye. And then depression, anxiety, upwards of 50, 60%. That's huge. And that's without a pandemic that's basically resulted in an anxiety pandemic as well as a coronavirus pandemic. I've enjoyed what you've been sharing, each of your just self-care strategies and things. Debbie, do you want to comment on this?
I do. My first job in college was I was a suicide prevention counselor, and that's how I met my husband. He was as well, and we got married, so that was wonderful. But a couple of things to know that you've got to acknowledge your frustration and your feelings because they're real, and so. It doesn't do any good to hide those or to ignore them, but to acknowledge them. The second thing is to think about the fact that as much as we're in this very real situation, it's temporary. We're not going to always be in the pandemic. And I never thought my eyes would have any feelings of being comfortable again, but it ebbs and flows now. And so even when you're in a very bad place, it's not forever. And we kind of get stuck there sometimes thinking that it will be. And one thing that it took me a couple of years to understand this, it's the small things that make a difference with dry eye. It's not the big things. It's consistently doing the treatment plan that the doctor has for you. And those little things, like when Rebecca was saying, keep your monitor lower than your head, and it helps so much. That's a tweak that can make you feel better. And all those things that we've talked about today, I've had 2 doctor's appointments in the last month, and those are the things they tell me. It's all the little tiny things that we're capable of doing at home. Another thing that has really helped me is I was an English teacher before I retired, and I was reading so many books a week, and I was so angry and frustrated that I couldn't read because it's one of my passions. I'm doing Audible books, and I read probably 5 books a week. I have unlimited numbers. I have 25 credits, and I'm reading constantly. I read when I do my chores. I read when I'm walking or running. I read when I'm lifting weights. And that has changed everything because it's something that I love and it gets my mind off of it. So those are my tweaks. I want to make sure other people get to say some things too.
Awesome. Debbie, do you want to comment on the mental health side of this big intersection we've got? Sorry, did I say Debbie? Laura. I'm looking at Laura and I'm saying Debbie. Sorry, Debbie.
Yeah, I do, because I think it is a big deal. I mean, I tend to trend anxious anyway. And very fortunately, I have primarily an ophthalmologist who is very steady emotionally. And I always joke, you can bill me for the ophthalmology as well as the mental health visit. Because one of the things I think is really important is to have providers that are non-reactive, if that makes sense. So it's sometimes, I mean, I understand that necessarily would, impacts you clinically in terms of the eye stuff, but I think having providers who you genuinely like and connect with and who are a good match for you as a person helps with this exponentially. Because I know even my subjective eye comfort is often better right after I've seen my ophthalmologist, even if she's done nothing, just because she's reassured me I'm not going blind, like this is fine, we're going to get through this. And something that was giving me pain prior to the visit, just the reassurance from that practitioner. So I think that key is like having practitioners that you can work really well with and who can support you through this, because it is a lot of ups and downs. And there are times where this is really difficult and I'm not seeing that well and I'm really frustrated. and I'm feeling really anxious about it, and it gets you down, and then, you can kind of steady you. The other piece of this is I have really learned how to say, I'm not having a good day today. It does not mean I'm never going to have another good day. Today is not a good day. Or even with the night stuff, I can't drive at night right now. It doesn't mean I'm never going to be able to do it again, even if we don't know what that technology is right now that would bring me back to it. Things are changing pretty rapidly. And so since I've kind of reframed things in that way, like, yeah, today, you know what, my eyes feel like crap today. I'm not going to be able to, but tomorrow's going to be a new day. And it really does go up and down so much that you just can't let those moments where it's not going the right way become too powerful, because the next day could be better or not. But it's just, you have to just be open to the fact that it is a marathon, not a sprint. And there are lots of people who can help you. There's lots of things that just as evidenced by all of the technologies and therapies that just the three of us have mentioned here, today. And I don't think any of us have hit the wall in terms of what's available. So there is so much, and I just try to focus on that when I'm feeling badly about it, because it's a problem for sure, but it's a manageable one if you stick with it and you have good people with you. So
Thank you. I love that. You're so right that there really is always more. I mean, I don't think we ever come to a point where we've exhausted every possibility, but it's not simply that there's a list of stuff and we check the boxes off as we go. Tried that, done that. I've got 15 of those in my drawer. It's also in how we do things and when we do things and whether we were methodical with it. Sometimes it's the devil in the details of, if you're doing something regularly every day for a time, or if something's really being tailored for the need at the time. I see sometimes a tendency for people out of anxiety to just churn through more and more stuff. And sometimes you have to take a step back and go back to basics and look at how we're trying things, even not just whether we've tried it. Yeah. And on the subject of doctors and finding a doctor that is supportive, somebody that you're comfortable with, actually I'm already plotting for our next happy hour session being all about doctors. How do we find good doctors? How do we communicate our needs to them? How do we walk into an appointment with expectations that are set in a place where they've got a hope of being met? How do we advocate for ourselves? There's just so many things about navigating medical care. What type of doctor even to go to for different types of needs. So looking forward to a next one. I'm looking at the clock. So I'm going to wrap up the formal part, if we can call it formal, of our panel discussion now. I just thank you all so much. You were really awesome. I've really, really enjoyed this. What we're going to do now is, to the extent anybody wants to stay, any participants that would like to have their audio and video on and jump in and talk with us, you are all welcome. And anybody who needs to nip out, that is it for today. Thank you all so much. So actually, Aiden, you want to tell, how do people get turned on?
Yeah, so raise your hand at the bottom of your screen and I can add you as like one of the panelists. Okay, I've got someone here. I guess I'll start adding everyone in just a second here, just so you know. Your video and name might be visible on YouTube because we're going to keep that live and it'll be in the recording as well. So before you jump in, just wanted to say that. And then I think we'll maybe discuss some questions once we get everyone in the group. So I'm going to start adding, I think, Norma. And
I'd like to say also, anybody who has been here just watching and maybe asking some questions in the chat room, I hope you'll think about volunteering for this, because everybody is an expert in their experience and their history with dry eye. You all have things to bring to the table, and everybody's got the things that they care about most and are most passionate about. So if you have any interest in being on a panel on a future Dry Eye Happy Hour, please contact us and let us know. Love to hook you up. All right, I see a couple new people in here. Elisa, anybody want to introduce themselves?
Hi, I'm Elisa. I want to tell Laura I'm wearing scleral lenses and I love them.
Yay!
All right, a fellow. How long have you worn them?
About 2 years. And I actually changed to a different kind that was made, like the problem I had is that they were getting dirty because my eyes don't close all the way, but I've got these new ones that are better that were made in the Netherlands or something. And they stay a lot cleaner and they're very comfortable. So,
That's fantastic.
yeah.
Did you get them specifically because of your lids not closing?
Yeah. Yeah. Well, I also had LASIK and that, so my cornea is all, and then just as I got older, my eyes just weren't closing that well. I still have problems at night, but the scleral during the day is great. It just feels normal during the day. So it's amazing.
Oh, that's wonderful.
Me.
Can I just jump in and say, I think my issue, Laura, is, I mean, I know certain people have success and certain people don't. I didn't have trouble like putting them in, taking them out, having them fog up. I had managed all of those things. I really think my problem is the whole nerve issue on the left side of my face. The right eye, we always could find a good fit. The left eye, I always thought the fit was off, but the doctors were always like, it looks great. It looks the exact same as your right eye. And now I'm starting to learn that I think it's more the nerve issue, which is something I've only come to realize in the last year or so. And I felt bad because all my doctors were like, it's great. I don't know why I can't help you. And I have messaged them and told them, don't worry, it wasn't your thing. I think there's more of a nerve issue going on. So still have hope. Don't worry.
I'm sorry that you have to go through that, though. That's very frustrating.
Oh, I went to like 3 doctors in a year, and it was a long process and frustrating because fitting them is a long process. Elisa, you probably know. I mean,
Yeah.
and all of you that wear them. So don't lose hope, people, just because they didn't work for me.
It's another thing where the details matter. I mean, everybody's different with sclerals. It's people come onto the group and ask, what's the best type? And it's like, oh my God. There is no best. It's what works for you, if any of them do. It just varies so much. I mean, I've been through quite a few different types over the years. And thankfully, I've had many that worked really well for me. But I can tell you just from all of my experiences, if I went down to a lens that was just a little too small in diameter, forget it. Not a chance. My eyes would just be so incredibly unhappy all day. I might see well, but I wouldn't be able to stand having them in my eyes. Norma, would you like to tell us about yourself?
Yes, I'm sort of new to the group. I don't know if you've had these before, but thank you so much for doing it. I'm sort of 30 years into dealing with dry eyes, and most of my career was in Seattle, by the way. And then I decided to move. It was much too moist there. So I now live in Denver, Colorado, which has to be one of the worst places in the world for dry eyes. But I did want to share, I think I'm doing most of the things that everyone talked about. I'm going to the University of Colorado right now, and they have a Dr. Houseworth that is new there that is sort of a dry eye specialist. So he's trying different things with me. And one thing nobody mentioned was Regenerize. Has anyone tried that? And do you know about that? It's
Is
new.
that the amniotic drop?
Yeah, I know lots of people that have used that actually. I never have myself.
I did the amniotic drops from, was it Regenerize? I can't think of the brand. Genesis, the Genesis drops.
Yep.
I did them for about a month, and I didn't really, they were very expensive, but that wasn't even why I stopped doing it. It just, nothing was happening. And then, and even my ophthalmologist was like, I don't see anything going on here. And then I did switch to the serum drops, and both she and I agreed there was a visible improvement with those. But I'm happy when I hear people have a good result with the amniotic drops. It just wasn't my experience.
Well, he has me. I've been on serum tears for a number of years now, and nobody mentioned, but I'm the mix. I'm on a 50% right now, which has really helped me to go to that level. And during this pandemic, there was a month and a half that I had to go without them, that no lab was doing blood draws to make them. And I realized how important that they were to me. So it was a real sort of eye awakener that they really are helping. The Regenerize I've done for 6 weeks now. I go back to the doctor in a month, and I think that there has been some improvement. It will be interesting to hear what the doctor says. And part of the thing was helping the function of the meibomian glands and some things. So interesting with that. The other thing, very simple, that he has me doing now too, is using Lumify twice a day. And, Lumify is really a very mild drop that used to be used for glaucoma. And the great thing of it is that it makes your eyes very clear and not red for about 6-7 hours. So that's the extra benefit. But I'm getting so much relief from using that now, just from the stinging and the burning. And it's over the counter. You can get it at, Walgreens. And so I asked him out, and he said, I know, because you get it over the counter, people don't think that it's medicine and that it really helps. But he said we're finding new tests and studies now are showing that it really is effective. So you might want to ask your doctor about trying Lumify. And again, not expensive, but you can get it anywhere.
It's a one to talk with an ophthalmologist about, if possible, too. I would love to see Lumify out in a preservative-free version. I think it does work really well for many people, but it's benzalkonium chloride preserved, and I worry about people with dry eye getting that much exposure to the preservative. Is that part of your, if you don't mind my asking, is that part of your kind of conversation about that? Or
he, as I said, he's somewhat new there. And I've been, I've gone to a number of different good ophthalmologists.
Mm-hmm.
It's a trial that we're doing to see. I just know from the results now, it just makes me feel so much better. But I've not been doing it I've been doing it for probably 2 months now, and I am getting relief from it. But you're right with the preservative, but so far it seems to be helping me with it. So it may be something that, to check with there. And you were talking about, the eye mask, and, my doctor had the ones with sort of the bean bag, I call them, that you heat in the microwave.
Like a brooder and that sort of thing?
Well, they've really helped me. The main thing is not that I realize that I need to go slowly with it and not try to heat it up real hot to go faster with it. So I have 2, and I'll put them both in, and I heat them, and I'll do one, and then I switch to the other and sort of go back and forth. And he's having me do it for 15 minutes. And then he's not saying to rub that, he's saying to blink really hard for about 10-15 minutes. Don't watch television because you're not blinking, and don't read during that time, and do it every day. He's having me just do it once a day right now. But he says you've got to trigger the glands, and the blinking is what he has me to do that. But they're very moist too. They add moisture. It's like a steam almost with it.
I love that you're getting such detailed directions from your doctor on how to do it. So I think a lot of eye doctors tell people to do warm compresses and lid scrubs, but don't necessarily tell them, what sort of thing to use, what works. Maybe give them a product suggestion, or say, here's how long to do it, here's how warm to get it, here's what to do with your eyes afterwards. So the point-by-point instructions, I think, are great. I think we should all hold our doctors to that standard of giving us specifics.
Also to the eye scrub, I think it's called Zorac. It has okra. It's made from okra, and the doctor recommended that. You can get it on Amazon, and It's much milder on my eyes. I really like it. The Avenova is also good for the scrub. So I switch between those two. I use one day and, a couple days, and the other one the other days, but both of those are quite nice.
Great, thanks for sharing that. Can we switch back for a moment to just the pandemic issue? I just want to bring, I haven't seen any questions in the kind of little Q&A panel, so I just want to bring the last question I had on my list up, which is, we know it's not going to last forever, but we do know that the pandemic is going to be with us for a while. I'm wondering what any of you feel will be the most significant impact from that on our dry eye community, so we can talk about, ways that we can work with that, things we can address. Anybody got thoughts on that? I mean, it could be from like people losing insurance, and how does that affect us? Or go for it, Mandy.
I had some notes on this from the questions you had posed to us. Honestly, the pandemic, I'm getting more sleep because I can just roll out of bed and go right to my desk. And as I said, I forego showering often and other things. I don't wear makeup ever anymore because it irritates me, which is part of the depression, anxiety. I really like makeup. And, that saddens me that I can't wear it. But sleep is amazing for me. I have a really hard time getting up in the morning and getting into the office. And if I can just roll out of bed at like 8:30, make my coffee, feed my animals, and go, to the computer, it's really, really nice for me. I like that component of it. I do think one really hard part is going to be the health insurance aspect. I'm really lucky because I work for the state of Wisconsin, and I work really closely with the governor's office. So I don't fear losing my job or my health insurance. And I know there's a lot of people out there that do have that risk, and it's very unfortunate. And I think that's going to be a really hard time. And not to bring politics into it, but I think that's going to really show the need for some sort of expansion of the Affordable Care Act. But that's, I think that will be really helpful for people. I think more people are going to need that access. And it's going to be really hard if we have to continue virtual, medicine and telehealth. So I see more of a need for this. I love the virtual happy hour, and I think it's really great for people to be able to listen to other people's issues and problems, because the mental health, anxiety, depression portion is huge for this. And not being able to talk to other people or get out and do things that with friends or family that might have lessened your anxiety and depression level in the past, that's going to increase it. So being able to see people and talk to people about the issues and hear what other people are going through, I think is really important. I love the Facebook group, but sometimes I feel like I need to limit my screen time. And so I haven't been participating as much lately, and that makes me a little bit sad. And so I'm trying to downplay that. But I think I love this virtual thing. Even though we're looking at a screen, we're not looking at it where we're like reading and typing and having to not blink, because you're not really thinking about blinking when you're reading and typing. And my job requires that all day long. So something like this is nice, just talking to people. I think this will be something that we can take out of it as positive and maybe hopefully continue this. So there are going to be some really good things we can take away from the pandemic that we're learning. I think also the ability to slow down and say no to things. I have a really hard time saying no and slowing down. And this is giving, although I haven't slowed down that much, it's affording, more time to be able to say, okay, maybe I should try to meditate today, or maybe I should try to do something else that maybe I'll have more time for because I'm not having to go into the office. And so I think I think we can try new things that we might be able to take away that'll be positive from this. Yeah.
I just wanted to say that I feel like there's going to be a lot more people having dry eye symptoms because of increased screen time, especially among students who are spending much more time on the screen to do all their studying and even reading their textbooks that way. And I would love to see us educate, because there are certain things that they can be doing now to keep from having dry eye symptoms, and students don't even know about this, especially the young ones, the elementary and the middle school, high school, and college too, I guess. I think everyone needs to be aware of just eye hygiene and what we need to do. Just like we brush our teeth, we need to take care of our eyes. And so if you have children at home and you're still listening, that would be a good thing to just, talk about blinking and limiting screen time and little things that can help your children and loved ones not get in this situation.
We have a pediatric ophthalmologist on the board, and you can bet we've been talking about this because with all these kids doing school online, their office is packed with kids that are coming in because of these types of eye symptoms. And that was already starting because kids get so much screen time with their phones and whatever. But now to have both their fun time and their school time be all about screens, it's just really hard on kids' eyes. So that's gonna just across the professions, ophthalmology and optometry, they're gonna really have to work hard to educate people about prevention. So the kind of dry eye epidemic in the making doesn't just get completely out of control with that.
I mean, there is a lot of concern to what Debbie said about kids anyway, being on the screen so much. They've seen a serious increase in dry eye problems in kids due to the not blinking and staring at the screen. So, I mean, like I said, for me, there's no change at all in the amount of time I'm on the screen because my job is researching and putting spreadsheets together and reading statutes. And yeah, there's been absolutely no change. The difference is that I don't have that air blowing on me. I'm not in the stale office environment. I can manage the air conditioning or go outside if I need some humidity right now, and be able to, I wear these glasses at work and everyone just has to deal with that I'm wearing these glasses. I've gotten over caring about what I look like with them on, and I do have to explain to people all the time, but it is what it is. But I like being able to be home and control the environment.
I love that you've embraced the glasses as, this is what it takes for me to be comfortable. And it makes a real difference when you go about it with that kind of confidence too. I think it makes a difference.
Well, it might be fake confidence at this point, but I'm getting better at it.
It's fine.
Yeah. Too, like one of the accommodations that I needed and probably still need to work to some degree is we can dim our conference room. And in the mornings, I can't handle that room full bore with the fluorescent lights. So I walk in, dim the lights, but if I'm not the first one there, I have to dim them with people in the room. And I just tell people, I'm just really open about it. And I find, people really want to be supportive. But it's automatic if you do some of these things and don't explain. So that's the one accommodation. The other one was when you mentioned the BAK, Rebecca, that one of the hypotheses about what was wrong with my eye when I was having that infection thing, whatever, is there was some thinking it was blowback from BAK and one of the medications I was taking. So not to be underestimated that can really irritate certain folks, and I may very well be one of them. I would start by explaining, this is not contagious. I don't have pink eye. I'm fine, and then just so we could move on, and I would imagine aid that any of us are using. People are extraordinarily kind and understanding as long as they know why you're doing something or why you're wearing so, whatever it is. But it does get a little weird if you walk into a room and dim the lights and don't tell anyone why.
I agree.
The most impact I've had personally on my eyes during coronavirus has actually been from working too many hours and not getting enough sleep, because not getting enough sleep really does mess with my eyes. And then we were terribly space constrained, and trying to bring staff back when we're in this really just crowded, narrow office wasn't gonna work. So I moved us to a much larger premises last month. And for the first time ever, basically, we've got air conditioning. I haven't worked in air conditioning in, 15 years. It's been a really long time. So that's an adjustment. And we haven't gotten our first electric bill, so I've been leaving that thermostat pretty high until I know how bad it's going to be. And then it gets warm, and then I have a tiny little fan in my office. And fans are awful for eyes too. So there's been some adjustments, but anyway. All right, well, there's lots to come back to, lots of things to follow up on. I'm excited to, in one of our future sessions, get on to kind of the financial and insurance side. I know we have people interested in advocating and lobbying, really, to get things covered by insurance that are not covered now. And there are precedents for that in other areas of medicine. A guy I've known with dry eye for a really long time has done work in that area of getting insurance coverage, kind of going state by state, working through that process to try to get things covered, and has ideas about how that can be done. I know we'd like to get involved in that at some point for dry eye, because I think we've got, first of all of these over-the-counter and consumer products that aren't covered by insurance. And that's a hefty out-of-pocket cost. Just drops is a lot. Then we got all the medical procedures and things, especially all the meibomian gland treatments. But then there's autologous serum and all these things that people need that aren't covered and are really costly. And so access is just limited to those who have got the means for it. And,
Scleral lenses.
Yeah.
Oh, yeah.
And some of those are things that we can fight for. If we've got a strong indication for scleral lenses, a medical indication for it, can go and fight with the insurance company. This is a medically necessary thing. It's not a vision appliance like glasses. It's something I got to have. But yeah, to get it actually policy.
Yeah, to that note, my insurance, it was a once in a lifetime coverage, because their knowledge of scleral lenses is that it's something you might need after you have cornea surgery. And so a one-time payment coverage of that is absolutely ridiculous. So educating the insurance companies and lobbying for it. Like I've said to Rebecca a million times, I wish all of us who experienced that could quit our day jobs and start a consulting company business, lobbying business. That's like my dream. Rebecca already does it, and she's awesome. So
your day will come. There's so many fun things to look forward to that we get to do. I think there really are. Okay, well, it is 4:30. Is there anything anybody wants to add to this, or can we go ahead and wrap up here? It looks like we had a couple additional people exit. Does anybody want to? Any of you that are just watching and listening now, any last questions or thoughts you want to share? Maybe no.
If no one else wants to say anything, I want to really reiterate Debbie's point about audiobooks and podcasts. It has been a lifesaver for me. I love to read as well, and I barely ever read a book with my eyes anymore. And there are some books that frustrate me because they're very factual, and I want to go back and look at information, and I can't. And so those are the books I find hard to listen to on audio, but everything else is awesome. Like, I absolutely love it. And it has been a game changer for me in acquiring knowledge and things I've even looked into at work. For blind people at work, they accommodate the screens and have everything read to you. And I know we have that capability, but it's weird. So I would love to have work provide that for me. And that's one thing I've thought about advocating for dry eyes and people that have eye issues in general, even if you're not blind. So it would be something that would be really great.
I've been at some keratoconus kind of patient support events. That's another corneal disease where they had people there educating the group about all the different types of accommodations that are available for people with the disease and how to go about asking. And I think there's a lot that we don't know that we could access and that would help. All right. Well, this has been just so much fun. It was, to me, this is a great big experiment, a little bit scary because cameras terrify me and all of that. I just really appreciate all of you and all that you put into this. There's just so much more than I had ever anticipated that's come out in the discussion. Really wonderful. Thank you, Debbie and Laura and Mandy, for being the first ones to do this. You were really wonderful.
Thank you for setting this up. It was really great. And for all the work that you and the Dry Eye Foundation do, it's just incredible. So thank you. Thank you.
And Aiden, thank you for all of the technical support. I couldn't have done any of this without you behind it all. All right, everybody. I will be talking with you again soon.
Great.
Right,
Thanks.
Thanks so much.
Thank you, everyone.
Great.
Bye.
Bye.
Right. I'm going to end the meeting now for everyone.
Thank you.
Bye, guys.